720, Big 550 KTRS. Our next guest here in studio, Jen Bersdale. You're Executive Director of Cover Missouri Coalition. Good morning, Jen.
Good morning, and just to be clear, I'm Executive Director of Missouri Healthcare for All, and we're members of the Cover Missouri Coalition.
Aha! My sheet is wrong. What is your organization trying to do?
So Missouri Healthcare for All is a statewide, nonpartisan, grassroots movement working for access to quality, affordable health care for all Missourians. And we are proud members of the Cover Missouri Coalition, which is a coalition of hundreds of groups and individuals from across the state working to make sure that Missourians know about their new health insurance options and can access them and get enrolled. You
say you're nonpartisan, but there are partisans who are telling people not to sign up for health insurance.
Unfortunately, this issue has been politicized by a lot of people. That's why we think it's so important to have organizations and a coalition that are really coming at it from the best interests of Missourians.
Okay, so who can sign up for this? Or let me ask you this question. When you talk to the rank and file citizen of Missouri, how informed are they about these new health care laws?
We've been doing public education since the law passed in 2010, and certainly there are a lot of people out there who still have questions, still don't understand it. But having done those presentations for the last almost 4 years, I'm happy to say that people really are getting more informed, especially as they start to know people who have signed up and are taking advantage of the law's benefits.
Go ahead, Kelly.
Do you find that there's still a lot of Missourians not signed up or not?
Of course, there are a lot of Missourians not signed up. A lot of Missourians really don't need to sign up. They already have some form of health insurance. They're covered. Very little changes for them. And people are signing up in Missouri, as we hear across the country. We've been collecting success stories from across the state, and it's been really exciting to hear those stories of folks who have been uninsured, unable to afford insurance, turned down because of pre-existing conditions, and really, have spent years worrying about what happens if there's something, an accident, an illness, who are getting insured, getting affordable insurance that's going to cover everything they need.
How many people do you run into, Jen, who can take advantage of the law? They're uninsured. They're out of a job. They have a pre-existing condition. They couldn't get insurance. Now they can. Now they can afford it and say, I'm against it on a philosophical basis, and I will not sign up for it.
Very few.
Really?
My experience is most of the people who find out that they're going to benefit from it are at least interested in checking it out. Why wouldn't you be? If you're uninsured, we all know that insurance is important. It protects us in the case of an unexpected illness or injury. And I think even people who have concerns about the law know that having insurance makes them safer. And when people find out they can benefit, they're generally interested in checking it out.
What about the young people who they said weren't going to sign up for this at all?
They've done studies that show that for young people who don't have insurance, the number one reason has been that they can't afford it. So I know young people who are signing up because all of a sudden, with the discounts available, they can afford it.
You're there. No, come on now. You're throwing logic into this, Jen, and this whole conversation falls apart. The whole Obamacare world is implodes when you throw common sense into this. Come on now. Let's throw a couple bombs here. This isn't any good. We're joking, of course, but somebody said this to me, and I thought it was really interesting. And explain this. Tell me I'm wrong. Tell me I'm right. But is this factually correct? If you make above the poverty level, the federal government is going to subsidize your health insurance to a certain point. If you make below the poverty level, since Missouri has rejected expanding our Medicare and Medicaid, if you make below the poverty level, you're not subsidized.
That is true, and it is the biggest real problem with the Affordable Care Act in Missouri, and it's a self-inflicted wound. We have a system now where a family of 4, mom and dad, 2 kids making $90,000 a year are likely to qualify for help affording their health insurance. And a single mom of 2 kids or a mom and dad with 1 kid, a family of 3 making $12,000 a year, those parents will not qualify for help. And that is because the law was passed with the expectation that we would have this Medicaid expansion, and it's really important. And we're hearing those stories too. We're hearing these exciting success stories, and we're hearing from people who need the help more than anybody else, who really are left out in the cold because we haven't expanded.
Okay, now hold on a second here, because this is really important. So that single mother who's working 2 jobs, making $15,000 a year, gets sick and has to go to the emergency room because she has no other alternative. The emergency room can't turn them away. She gets bad health care. It costs more. She doesn't pay for it. We end up paying for it. And there's an alternative to that, which is, so we're being taxed for this money, not getting it back, and giving our citizens worse health care for it. Is that correct?
That's correct. It's a terrible system. I think we all know that it's better for people to get a cancer screening than to be treated for advanced cancer. It's better to have your blood pressure tested than to not get treatment until it's high and you're suffering those side effects. And it's true. We all pay. Those of us who have health insurance pay for the people that go to the insurance room for treatment that will stabilize them, but it's not going to make them healthy. They're going to be back in the emergency room again. Expanding Medicaid will be good for everybody. It's going to bring federal dollars that came from our taxpayers back to Missouri. It's going to protect our hospitals from some pretty serious cuts, keep them there to serve all of us. And it's going to provide health insurance to a lot of people who need it. You know, the most important thing, the thing that gets me out of bed every day to do the work I do, is that we know from study after study that people without insurance live sicker and they die younger. And I know the stories of people who have lost family members because they were uninsured. And so really for us, that's why you cut through the politics, because this is about real people. It's about their lives. And it's about, people living productive lives, being healthy enough to go to work and not dying from premature illnesses that could have been treated.
Hospitals in rural Missouri going to start closing here pretty soon?
It's too soon to say if we're going to see closures. I think it's extremely likely. We're already seeing layoffs. They're talking about cuts to services. Certainly people have talked about that possibility.
This is in rural Missouri.
We could see impacts here in the St. Louis region, too. We're talking about major cuts to all of our hospitals. And, we don't know yet which hospitals are going to do.
Why is that?
So the law provides for cuts to payments from the federal government to subsidize care for the uninsured, on the supposition that because of Medicaid expansion and the subsidies, there will be fewer uninsured people. Because Missouri hasn't expanded Medicaid, we will have fewer uninsured people, but not the cuts predicted. But those cuts to those federal payments to the hospitals don't go away. So we have hospitals that are going to be serving the same number, or close to it, of uninsured low-income folks without the funding that has helped them serve them in the past.
So in layman's terms, the federal government is saying, look, you used to be treating a lot of uninsured people. Now, since we're going to expand Medicaid, those uninsured people are all going to go away, so we're not going to pay you that money. But since the state says, but we're not going to take your money to expand Medicaid, so those people are still going to go to the hospital. The federal government's not going to reimburse the hospitals, and they're not going to have the health benefits of being on some type of group plan, if you will. So we're shooting not only ourselves in the foot, but also in the hand and the other foot as well.
That's true. And it's important to remember, of course, we all use these hospitals. So those of us who have health insurance, that's great. If the local hospital cuts services, cuts psych beds, cuts emergency room beds, we're no better off at that point.
All right. What do we need to know? What do you want people to know coming in here? And last words to tell people what they should know and what you want to tell them.
Two things. One is for folks who have not had insurance or haven't had affordable insurance. There are new options that they should go find out what they are. Good coverage with discounts for a lot of people based on income. And the system is working. So if you haven't checked it out or you had trouble earlier this fall, you should check it out. And the other thing really is it is so critical that Missouri expand Medicaid. We didn't do it last year, but it's not too late. The legislature is back in session this week. They've got until May, and we think it's their top priority to find a way to cut through the politics and expand Medicaid for Missouri.
John Deal was here yesterday. He basically said there's no way they're expanding Medicaid.
We're just not ready to accept that answer. There are lives on the line here. And, we elect our elected officials to serve the interests of Missourians, and we're confident that they could find a way to do it, and we're going to keep talking to them until they do.
All right, that's Jen Bersdale, you're executive director of Missouri Healthcare for All, and you're also part of the Cover Missouri Coalition?
Yes, that's right.
And how can people find more information?
CoverMissouri.org is the Cover Missouri Coalition website. Tons of information, not only about the coalition, but about the new healthcare options. And then our organization is online at mohealthcareforall.org. coalition.org. And of course, both the coalition and our organization are on Facebook and Twitter as well.
You know, it really doesn't help when you start spewing facts out here. You know, it doesn't help anybody.
I'm sorry to disappoint. That's all I've got to offer.
Keep doing your thing, though. Keep doing it.
Throwing all these facts on things really is not good. Jen, be safe, and thanks for coming in.
Thanks for having me.
7:30 here, Big 550.